It tastes like honey, like a promise of safety. But the promise is a decoy. The molecule enters the body harmless, and the liver, doing its job, transforms it step by step into microscopic razor blades of calcium oxalate. They lodge in the kidneys. They shred tissue from the inside. The sweet taste was never a guarantee. It was a trap. This is the deep archive. We leave the surface now. The hatch seals. Pressure builds. Below, the evidence waits in sealed files. A chemist's notebook from 1859 noting remarkable mint dew, remarkably sweet, with no alarm. A blue jug of antifreeze in a garage, still sweet after a century. Snowflakes under a microscope, crystals that were once a drink. A dog collar on a dark driveway, a mother's spoon. We descend into the quiet room where the poison becomes its own archive. The molecule does not change. It only waits for the next hand. The hatch closes. The real story begins. In the autumn of 1859, the gas lights of Paris burned low and uncertain. They flickered against stone walls and glass cabinets, casting long shadows across a laboratory that smelled of coal tar and cleaned glass. The man at the bench was Charles-Adolphe, 42 years old, a professor of organic chemistry at the École de Médecine, and he was holding something new in his hands. It was a liquid, clear, viscous, faintly translucent, with the weight of a honey that had never known a bee. He had made it by reacting ethylene oxide with water, a procedure that required patience, the slow drip of one colorless reagent into another, the careful regulation of temperature, the waiting that is the real currency of discovery. The reaction completed, he drew a small quantity into a pipette, transferred it to a beaker, and did something that would have made his German counterparts wince. He tasted it. In 1859, this was not recklessness. It was a routine method of identification. Chemists had always used their own bodies as instruments, trusting the tongue to distinguish between alcohols and acids, between esters and ethers. Wirtz dipped a clean glass rod, touched it to the liquid, and touched the rod to his tongue. The sweetness arrived instantly. He described it in his notebook as syrupy and pleasant, the handwriting neat, unalarmed. There was no tremor in the ink. He did not stop to wonder what that sweetness might mean. He recorded it as a property, nothing more, exactly as he would have recorded the boiling point or the refractive index. The journal entry closed with the satisfaction of a man who has added a new substance to the catalog of organic chemistry, who has named it ethylene glycol, and who has no reason to suspect that he has just chipped the first fragment off an iceberg. The compound was interesting precisely because it was sweet. Sweetness in organic chemistry was not uncommon, but it was rare. Most synthetic compounds tasted of nothing, or of metal, or of the sharp bitterness of nitrogen and sulfur. To find a new molecule that mirrored honey or fruit or sugar was a small marvel. It suggested utility. It suggested that the molecule might fit neatly into the human body, that it might be accepted rather than rejected. And so the early reports on ethylene glycol were optimistic. The substance was stable at low temperatures, which made it valuable as a solvent. It did not corrode metals as readily as some alternatives. It mixed with water in all proportions, a property that glycerin also possessed, but glycerin was becoming expensive because of its use in explosives manufacture. Dynamite needed glycerin to stabilize nitroglycerin. The demand had driven prices upward, and industries that relied on glycerin for other purposes were looking for replacements. Ethylene glycol offered itself as a candidate. It was cheaper, easier to produce, and, again, sweet. That sweetness seemed like a bonus. It meant the compound was pleasant to handle, agreeable in a factory setting, unlikely to cause the kind of instinctive disgust that drove workers away from more acrid chemicals. The industrial journals of the 1860s carried notices about its potential. A few pharmaceutical tinkers began to consider it as a base for syrups. If the compound was sweet and harmless, and why would it not be harmless since it was sweet, then it could replace sugar in some preparations. It could be a cheap filler, a sweetener that did not ferment, that did not crystallize, that could sit on a shelf for years without changing. The logic was so seductive that no one stopped to ask the core question: does the body know what to do with this molecule? The answer, which would not arrive until animals had died in cages, is that the body does not know what to do with ethylene glycol. The body treats it as it treats alcohol. It sends it to the liver for processing. But the enzymes that alcoholics have trained over decades, the same enzymes that break down ethanol with reasonable efficiency, have no true mechanism for this newcomer. They take the molecule apart piece by piece, each step creating a compound more toxic than the one before. The first metabolic product is glycoaldehyde, which damages cellular membranes. The second is glycolic acid, which causes severe metabolic acidosis, a disturbance of the blood chemistry that can depress breathing and consciousness. The final product is oxalic acid, which combines with calcium in the blood to form crystals that are, at the microscopic level, razor sharp. These crystals lodge in the kidneys. They shred the delicate tissue of the nephrons. They turn the organs of filtration into collections of scarred, failing pulp. The process takes time, 12 hours, sometimes 24. The victim does not become suddenly ill. They feel intoxicated, then drunk, then groggy, then confused. They complain of nausea. They may see what they describe as snowflakes in their urine, small white crystals, the first physical evidence of the damage inside. By the time a doctor recognizes the pattern, the original poison is often gone. The body has already converted it. The forensic chemist tests the blood for ethylene glycol and finds nothing. The poison has disappeared into its own consequences. This is the central irony of the sweet discovery. What made the molecule attractive, its taste, its miscibility, its apparent gentleness, was exactly what made it lethal. It did not warn the drinker. It did not burn the throat, did not cause immediate vomiting, did not announce its presence with the violence of acids or the heat of strong bases. It entered the body as a friend and became a tax collector inside the kidneys. The animal trials that finally revealed its danger were not done out of suspicion. They were done out of curiosity, in the ordinary course of testing new substances before they entered commerce. A few dogs were given small doses of ethylene glycol mixed into their food. The dogs drank the mixture eagerly because it was sweet, and then over the next 2 days they sickened and died. The autopsies showed kidneys packed with crystalline deposits. The pathologist noted the presence of calcium oxalate, the same mineral that forms kidney stones in humans, but here it was not a dull ache in the lower back. It was a flood. It was 1,000 small wounds closing the nephrons one by one. The report was filed. The compound was removed from consideration as a sweetener. The manufacturers went back to using sugar, which has its own metabolic problems but does not turn into glass inside the renal pelvis. But the compound did not disappear. It was too useful for other purposes. It became antifreeze. It became a coolant in automotive systems. It became a solvent in inks and paints and synthetic fibers. It became a chemical that millions of people would keep in their garages, in their workshops, in the back of their refrigerated trucks, often in containers that had no warning label stronger than a skull, and crossbones drawn in the imprecise language of industrial safety. The sweetness remained. Ethylene glycol is still sweet. It has not changed its molecular shape in the century and a half since Wirtz first tasted it. It does not degrade, does not acquire bitterness, does not develop an off-putting odor as it ages. It remains exactly what it was in 1859. A clear, viscous liquid that tastes remarkably like the promise of something harmless. The gaslit laboratory is gone. The notebook that held Wirtz's careful notation is preserved in a university archive, behind glass, in a climate-controlled room. The ink has faded to sepia. The phrase "remarkable Mendu" is still legible. The hand that wrote it expected nothing from the future. It was a registration, not a prophecy. The sweetness was noted, the compound was named, the beaker was rinsed, and the story continued into a world that had not yet learned to be suspicious of something that tastes like candy and arrives in a bottle labeled for industrial use. The discovery did not end the story. It made the story portable. From a single flask in a Parisian laboratory, the molecule traveled outward, into factories, into pharmacies, into automobiles, into the houses of people who would never know its name. It traveled by ship, by train, by truck, in barrels and jugs, and eventually in the plastic bottles that sit on garage shelves beside the motor oil and the windshield washer fluid. It traveled faster than the warnings could follow. And somewhere, in the quiet margin of that first journal entry, between the boiling point and the specific gravity, there is an absence. No toxicity assessment, no mention of caution, no note that the sweetness itself should be treated as a suspect. Wirtz was not negligent. He was working within the standards of his time, but the standard of 1859 was not equipped to measure the gap between a pleasant taste and a fatal dose. That gap would be measured later, in animal tissue and human urine, in emergency rooms and courtrooms, in the cold white light of a forensic autopsy. It would be measured in the bodies of children who drank from a puddle of spilled coolant, in the bodies of patients who received syrups that were never meant to be swallowed, in the bodies of men and women who had been given a glass of something sweet by someone they trusted. The archive does not accuse, it only preserves. And in the preserved ink of a chemist who tasted something new and found it pleasant, there is a question that no journal entry of 1859 could answer. What else might be hiding in the sweetness of a molecule that nobody has thought to distrust? The first sign is a taste, not the taste of the liquid itself that has already faded, dissolved into the warmth of the throat, the memory of something sweet and innocuous, like the residue of a cheap candy left too long on the tongue. The first sign is a taste of something else, something the drinker cannot name, a metallic film at the back of the mouth, a faint chemical ghost that lingers long after the glass is empty. But by then, the glass is irrelevant. The molecule has already begun its journey. There is a locked room inside the human body, and the key is held by an enzyme called alcohol dehydrogenase. Its purpose is ancient, to break down the alcohols that arise from fermentation, to clear the system of compounds that might cloud judgment or damage tissue. It works with remarkable efficiency, stripping hydrogen atoms from ethanol molecules, converting them into aldehydes, and then into harmless acids, The enzyme has no politics, no preferences, no memory of the millions of drinks it has processed over a lifetime. It simply does its job. And its job, when faced with ethylene glycol, is the same. The problem is not the enzyme. The problem is the substrate. Ethylene glycol arrives at the liver as a simple diol, 2 carbon atoms, 2 hydroxyl groups, a structure so unremarkable that it could be drawn on a napkin in seconds. The enzyme binds to it without hesitation, because the molecule is close enough to ethanol to fit the active site. It is a matter of chemical courtesy. The enzyme treats the poison as an ordinary guest. It cuts the first bond, adds an oxygen, and produces glycolaldehyde. Then another pass, another oxidation, and glycolaldehyde becomes glycolic acid. Then a third step, a slower one, catalyzed by lactate dehydrogenase, and glycolic acid becomes glyoxylic acid. And finally, with a last enzymatic nudge, glyoxylic acid becomes oxalic acid. 4 steps, 4 transformations. Each one brings the drinker closer to a state that no amount of medical intervention can fully reverse. The sweet liquid turns into microscopic razor blades not because it was ever sharp, but because the body's own machinery, working with perfect fidelity, builds the weapon from the inside out. The oxalic acid does not wait. It is a molecule with a single urgent desire to find calcium. Calcium is everywhere in the blood, in the serum, in the cell walls, in the signals that make muscles contract and nerves fire. Oxalic acid grabs calcium atoms with a hunger that is almost romantic, forming crystals of calcium oxalate. These are not soft, rounded structures. They are needles, prisms, jagged shards that catch the light under a microscope like broken glass in a gutter. They travel through the bloodstream, carried by the same circulation that delivers oxygen to the brain, and they lodge where the vessels narrow. The kidneys are a favorite destination. The glomeruli, the delicate filtering units, are dense with tiny capillaries. The crystals scratch and tear and embed themselves in the tissue. The kidneys respond with inflammation, swelling, and eventually failure. But the crystals do not stop there. They travel to the brain, where they can cause seizures and confusion. They lodge in the walls of arteries, provoking spasms and microhemorrhages. They drift to the heart, where they may disrupt the electrical rhythm that keeps the organ beating. The patient does not feel the crystals forming. The first symptom is often a vague nausea, a sense of intoxication without euphoria. Then comes a period of deceptive calm, sometimes lasting hours, during which the drinker may believe they have escaped harm. This is the quiet phase, the interval between the last sip and the first real damage. It is a medical trap because the poison itself is already gone. Ethylene glycol has a half-life in the blood of roughly 3 to 5 hours. By the time the patient shows up in the emergency room, the original molecule has been metabolized into its toxic children, and the blood tests that look for the parent compound come back negative. The doctor sees a patient who smells of nothing unusual, who may be disoriented or drowsy, whose urine under a basic microscope shows something strange, faint, birefringent shapes, like snowflakes caught in a winter window. The snowflakes are the crystals. They are the signature of a crime that has already been committed. In a quiet ER at 3 in the morning, the lights are dimmed to a fluorescent hum. The patient lies on a gurney, and 4-line taped to the inside of the elbow. The bag hanging from the pole is not saline. It is not a sterile electrolyte solution. It is a clear liquid that, in another context, might be served over ice in a bar. Ethanol, medical grade, diluted to a concentration that keeps the patient's blood alcohol level at a carefully calibrated plateau, high enough to saturate the alcohol dehydrogenase enzyme, low enough to avoid respiratory arrest. The ethanol binds to the enzyme's active site and stays there, refusing to let go, occupying the catalytic pocket like an unwanted guest who will not leave the doorway. As long as the ethanol is present, the ethylene glycol cannot enter. It circulates, unmetabolized, through the blood, waiting for a chance to be excreted harmlessly by the kidneys. The cure is a competition. 2 poisons, 1 enzyme, 1 binding site. The body becomes a negotiation table where the outcome depends on which molecule arrives first and stays longest. There is an alternative antidote, fomepizole, which works by a different mechanism. It does not compete for the same binding site. Instead, it binds directly to the enzyme and deactivates it, like putting a lock on the door. Fomepizole is cleaner, more predictable, and less likely to cause the stupor and hypoglycemia that the ethanol drip inevitably brings. But fomepizole is expensive. It is not always available in the pharmacy at 3 in the morning, and so the vodka bag remains a common sight in emergency rooms wherever the budgeting board decides that a patient's life is worth the cheaper option. The paradox is clinical but not abstract. The antidote that saves a life is the same substance that, in the wrong dose, destroys the liver, the brain, the pancreas. The patient lies in a controlled intoxication, watched by nurses who check the blood alcohol level every hour, adjusting the drip rate like a bartender with a medical license. The line between treatment and poisoning is a decimal point on a lab report. This is the slow crystal. It does not form all at once. It takes time, 12 to 72 hours, depending on the dose, the patient's age, the state of their liver, the availability of the antidote. In those hours, the body is a factory running a dangerous production line, and the doctors are trying to shut it down before the final product reaches the shipping floor. The snowflakes appear in the urine first. Then, the creatinine rises. The patient becomes confused, then agitated, then comatose. The heart rate accelerates, then stutters. The kidneys swell and stop filtering. The lungs fill with fluid. And somewhere in the sequence, a decision is made to dialyze, to infuse more ethanol, to call the nephrologist, to tell the family that the prognosis is guarded. The record shows a cure. The margin shows a cost. The cost of the ethanol drip is not just financial. It is the cost of keeping a patient drunk for days, of managing the delirium that follows, of explaining to a spouse why the loved one smells like a distillery. The cost of fomepizole is a budget line that hospitals sometimes choose not to stock. The cost of the poison itself is negligible, a few cents per fatal dose. And the cost of prevention, of bittering agents in every jug of antifreeze sold in every garage across the country, is a legislative battle that drags on for decades. The body keeps its own books, and the bottom line is written in calcium oxalate. There is a moment in the emergency room, during the quiet hour before dawn, when the nurse checks the patient's urine output and sees the faint shimmer of crystals in the plastic tubing, the snowflakes. The patient might still be conscious, might complain of a dry mouth or a headache, might ask for water. The nurse does not offer water. The nurse adjusts the drip, checks the vital signs, writes a note in the chart. The note says, "Patient receiving ethanol therapy for suspected ethylene glycol ingestion." It is a clinical sentence, dry as the paper it is written on. But the sentence holds a world of inference, the taste, the glass, the sweet decision that led to this room. The slow crystal is not a punishment. It is not a judgment. It is a chemical consequence, indifferent to intention, indifferent to the reasons that brought the patient here. Whether the drink was taken by accident, by malice, or by despair, the crystals do not discriminate. They are the final product of a process that began with a single swallow, and they will continue to grow until the body either clears them or succumbs. The doctor who administers the ethanol is not performing a miracle. The doctor is making a bet that the competitive blockade will hold long enough for the kidneys to excrete the unmetabolized poison before the crystals cause irreversible damage. It is a race between two sugars, one sweet, one alcoholic, and the finish line is a nephrology consultation. The room is silent. The 4-bag drips. The patient's eyes are half closed, seeing shapes that are not there, hearing sounds that have no source. The snowflakes in the urine are real. Everything else is negotiation. The cure is not a clean knife. It is a treaty, signed in the blood, between two poisons that came to the same bargaining table. The bottle was small enough to fit in a coat pocket, but its contents changed the shape of a continent. In a market town in tropical Africa, a mother spooned cherry-colored syrup into her child's mouth. The liquid was sweet, as medicine often is for children, masked by artificial fruit flavor. She did not see the drum from which it came, sitting in a back room of the pharmacy, marked with a single line of text that was never translated into her language: solvent, not for human use. The drum had arrived weeks earlier, delivered by truck from the port. One of many identical barrels stacked in a warehouse where labels were sometimes washed off by rain and replaced with hasty handwriting. The syrup maker had run out of propylene glycol, the standard diluent for children's paracetamol, and the warehouse manager had sent a substitute. The substitute was ethylene glycol. It looked the same. It tasted the same. It was half the price. The 1920s in the United States taught a similar lesson in cheaper alternatives. Prohibition had closed the legal distilleries, but it did not close human thirst. Speakeasies and back room bars thrived on bootleg liquor, much of it cut with substances that mimicked the mouthfeel of genuine alcohol. Ethylene glycol was one of them. It was sweet, clear, and far less expensive than ethanol. A few gallons could stretch a batch of whiskey into twice as many bottles, and the customers rarely complained of an odd taste because the sweetness was pleasant. They complained later when their vision blurred and their kidneys began to fail, but by then the hollow laughter of the market had long since moved on to the next batch. The clusters of poisoning that appeared in scattered cities, Cincinnati, Detroit, Philadelphia, were noted in hospital charts and then forgotten. No one traced the deaths back to a single chemical. The bodies were buried, and the bootleggers continued their arithmetic. The strange part was not that the poison was used, but that it was used in plain sight. The same sweet liquid that killed in speakeasies was also being sold openly as an industrial solvent, a coolant, a de-icer. It had no medical purpose. It had no business inside a human body. But the boundary between industrial chemicals and consumables was porous in the early 20th century, policed only by price and habit. If a substance looked harmless, tasted harmless, and saved money, it found its way into food, drink, and eventually medicine. In 1937, the boundary collapsed entirely. The S.E. Massengill Company of Bristol, Tennessee, was a reputable pharmaceutical manufacturer. They had developed a liquid formulation of sulfanilamide, a new antibiotic that was saving lives against streptococcal infections. The problem was that the drug did not dissolve easily in water. The company's chief chemist, Harold Cole Watkins, searched for a solvent and found diethylene glycol, a chemical cousin of ethylene glycol, sweet, clear, and capable of holding the drug in solution. He did not test it for toxicity. There was no legal requirement to do so. The elixir sulfanilamide was shipped across the country in September 1937, labeled as a cure for sore throats, gonorrhea, and scarlet fever. Within weeks, patients began to die. The pattern was unmistakable: kidney failure, crystals in the urine, the slow shredding of internal tissue by calcium oxalate. The company recalled the elixir, but not before 107 people had been killed, many of them children. Harold Cole Watkins, who had mixed the batch and tasted it himself to confirm its palatability, committed suicide before the investigation could question him. The company paid a fine of $26,000, roughly $1 per death. The disaster did not remain silent. The public outcry forced the United States Congress to act. In 1938, the Food, Drug, and Cosmetic Act was signed into law, requiring manufacturers to prove the safety of any drug before it could be sold. It was the first legislation of its kind, a direct response to the sweet taste of a solvent that had never been intended as medicine. The law was a milestone. It was also incomplete. Because the 1938 Act regulated drugs, it did not regulate industrial chemicals unless they were explicitly used as drug ingredients. Ethylene glycol itself remained unregulated. Its chemical cousin, diethylene glycol, remained unregulated. The law assumed that any future misuse would be prevented by the requirement for pre-market safety testing, but it underestimated the inertia of supply chains. A barrel labeled solvent could still be mistaken for a barrel labeled propylene glycol. If the handwriting was poor, the warehouse was dark, and the price was right. 3 years later, in Nigeria, a pharmaceutical supplier received a shipment of drums from a chemical distributor. The order was for propylene glycol, the standard diluent for children's paracetamol syrup. The drums arrived. They were heavy, silver, and unmarked except for a stenciled code. The warehouse manager did not test the contents. He signed the invoice, and the syrup was manufactured, bottled, and distributed to pharmacies in cities like Lagos, Ibadan, and the market town where a mother would soon spoon cherry-colored liquid into her child's mouth. The first children died within days. The doctors saw the same symptoms: stomach pain, vomiting, no urine, confusion, then silence. Autopsies revealed calcium oxalate crystals in the kidneys. The toxicology labs looked for diethylene glycol, the known killer from 1937, but they found ethylene glycol instead. The same molecule, the same mechanism, the same sweet taste that had never triggered a warning. Over 100 children died before the contamination was traced to a single barrel mislabeling. The chemical distributor had supplied ethylene glycol in drums that were supposed to contain propylene glycol. The two substances are nearly identical in appearance, taste, and viscosity. Only their molecular structure and their toxicity differ. The warehouse had no way to tell them apart. The pharmaceutical company had no requirement to test. The regulation that existed in the United States after 1938 did not apply in Nigeria, and even if it had, it would not have caught the error. The mistake was made before the drum ever reached a factory. The strange part was not that it happened. The strange part was that it had happened before. In 1937, a similar barrel error, or a deliberate cost-cutting substitution, had killed over 100 people in the United States, and the law that followed was supposed to prevent exactly this. But the law had been written for drugs, not for industrial solvents. It assumed that the supply chain would police itself. It assumed that the sweet taste would not be mistaken for safety again. The bottle in the pharmacy was small enough to fit in a coat pocket, but its contents had traveled across an ocean, through a port, through a warehouse, through a factory, through a distributor, through a pharmacist's hands, and into a child's throat. Each step in that chain was a transaction. Each transaction was a handshake between people who did not know what the other was holding. The 1938 Act was a good law. It saved countless lives. But it could not save the children in Nigeria, because the poison did not come from a drug. It came from a drum labeled solvent. The law had no jurisdiction over solvent. The law had no jurisdiction over cost. The law had no jurisdiction over the sweet taste that made the substitution invisible. The archive does not forgive, but it does keep records. The record shows a barrel. The margin shows a price. The invoice shows a signature. The body shows a crystal. The mother shows a spoon. The child shows nothing at all, because the child is no longer there to show anything. The discovery of ethylene glycol in 1859 was a scientific advance. The regulation of pharmaceuticals in 1938 was a legislative advance. Neither advance prevented the next death, because the gap between discovery and wisdom is not filled by law alone. It is filled by the slow, patient work of testing every barrel, every label, every sweet liquid, every time. And that work is expensive. And that work is boring. And that work is often skipped because the drum looks right, tastes right, and costs half as much. The pharmacy in the market town was quiet after the last child died. The mother did not return. The remaining bottles were collected and incinerated. The drum was returned to the supplier, who disclaimed responsibility because the label was ambiguous and the invoice was signed and the transaction was complete. The archive closes the file. The sweet taste remains. There is a sound that concrete makes when it has absorbed a spill for weeks. It does not dry evenly. It darkens in a slow bloom, like a bruise held at the edge of decay. On this floor, in this garage, the stain is almost gone now, but the jug remains. A pale blue plastic container, the kind that holds a gallon of antifreeze, standing upright in a corner where the light from the single naked bulb barely reaches. Someone has drawn on the side with a crayon. A child's drawing of a car, lopsided, 4 wheels that are circles inside, circles. A smiling face where the windshield should be. The spout is still sticky. The residue smells of birthday cake. It is not an unusual smell in a garage. Ethylene glycol, the active ingredient in most automotive antifreeze, was described by its discoverer as syrupy and pleasant. That description, written in a Parisian laboratory journal in 1859, never contained a note of caution. The sweetness was treated as an accident of chemistry, not a prophecy. By the time the compound found its way into millions of radiators and cooling systems, the sweetness had become an incidental fact, a footnote in patents and shipping manifests. But it was never incidental. It was the bait. The garage is where the poison lives in plain sight. Not behind a locked cabinet, not under a pharmacist's supervision, but stacked on a shelf beside a can of motor oil, within reach of anyone who walks past. A gallon of antifreeze costs less than a bottle of wine. It is sold in gas stations and hardware stores, in plastic jugs that are designed to be poured, not locked away. And because it is ethylene glycol, because it is sweet, because it is indistinguishable from a clear syrup when diluted, it became the weapon of choice for a particular kind of murder. Not the murder of strangers, not the murder of enemies, the murder of spouses, of children, of patients in hospital beds. Domestic poisoning, the kind that happens in houses where no one locks the garage door. The mechanism of the crime is not what most people imagine. The poison itself, the clear liquid in the jug, is not the killer. Ethylene glycol is harmless in its original form. It circulates through the body without causing damage, without provoking pain, without raising alarms. The danger begins only when the body tries to process it, when the liver reaches for the same enzymes that break down ethanol and unwittingly transforms the innocent molecule into something sharp. The metabolic chain is a cascade: first glycolaldehyde, then glycolic acid, then glyoxylic acid, and finally oxalic acid, the end product, the reason the body begins to destroy itself. Oxalic acid finds calcium in the bloodstream and forms crystals, calcium oxalate, microscopic shards that lodge in the kidneys, the brain, the lining of blood vessels. The crystals are not soft, they are sharp. They tear tissue from the inside, slowly, over hours, over 2 or 3 days, while the patient complains of nausea, of flank pain, of seeing snowflakes in their urine. The snowflakes are the crystals. And here is the detail that makes prosecution difficult, that turns a criminal case into a medical mystery. By the time the symptoms appear, by the time a doctor orders a toxicology screen, the original ethylene glycol is often gone. It has been metabolized. The body has done the work of eliminating the evidence. What remains is the oxalic acid, the crystals, the damage, but not the poison itself, not the molecule that could be traced back to the jug in the garage. The poison hides in time. It uses the liver as an accomplice, and by the time anyone thinks to look, the accomplice has already disposed of the weapon. In 1991, a mother in Missouri named Patricia Stallings was convicted of poisoning her infant son with ethylene glycol. The child, Ryan, had been hospitalized repeatedly with mysterious episodes of vomiting, lethargy, and metabolic distress. Blood tests showed elevated levels of a compound that looked like the fingerprint of antifreeze poisoning. The prosecution argued that Patricia had deliberately laced his formula. She was sentenced to life in prison. The case seemed closed. The jug in the garage, if there was one, was never found. But the evidence that convicted her was not as solid as it appeared. The compound detected in Ryan's blood was not unique to ethylene glycol. It was also produced by a rare genetic disorder called methylmalonic acidemia, a condition in which the body cannot break down certain amino acids properly. The same chemical markers that looked like poison were, in fact, a cry for help from a malfunctioning metabolism. Ryan had the disease. The conviction was overturned, and Patricia Stallings was released, but not before the system had demonstrated how easily a forensic test can mistake a birth defect for a murder weapon. The Patricia Stallings case is often cited as a cautionary tale about the limits of forensic chemistry, but it is also a parable about the poison itself. Ethylene glycol does not need to be administered to produce its signature. The body can generate all the same signals on its own, using only the materials of its own failed biochemistry. The line between poisoning and illness is not always a line. Sometimes it is a gradient, a blur, a coincidence of enzymes that the law is not equipped to parse. The difficulty of detection is not the only thing that makes the garage murder so insidious. It is also the availability of the weapon. There are millions of jugs like the one on the concrete floor, in millions of garages, in every city and town where cars are driven and radiators are filled. The sweet taste ensures that the poison is not immediately rejected, not spat out, not noticed until it is too late. A child finds the jug, opens the spout, takes a sip. A dog laps at a puddle on the driveway. A husband pours a measured amount into a glass of juice. The sweetness does the work that the poison cannot do alone. It invites the first swallow. And then the poison vanishes. The body metabolizes it, turns it into crystals, turns it into pain, turns it into a series of symptoms that look like kidney failure, like diabetic ketoacidosis, like a dozen other conditions that fill emergency rooms every night. The doctor orders a toxicology screen. The result comes back negative. The poison is gone. The case becomes a medical mystery, or a sudden tragedy, or a closed file in a prosecutor's office. Only the jug remains, sitting on the garage floor, the child's drawing still smiling, the spout still sticky with the residue of something that tasted like a promise. The sweet taste of death is not a metaphor. It is a physical property, a chemical fact, a quality that was noted in a laboratory over a century ago and never corrected. The sweetness is still there, in every jug, in every spill, in every sip that someone takes without knowing what they are swallowing. The poison that hides in clear, sweet liquid also hides in time. Its most dangerous quality is not its toxicity, but its absence from the body exactly when doctors look for it. It turns a chemical crime into a medical mystery, and the mystery does not always get solved. In the garage, the light is off now. The jug sits in the dark. The drawing of the car, with its smiling windshield, is barely visible. The smell of birthday cake lingers, faint, almost pleasant, waiting for the next hand that reaches for it. The legislative hearing room was not designed for silence. It was designed for argument, for the clatter of papers, the shuffle of polished shoes, the murmur of aides leaning into ears. But in the winter of 1996, before a subcommittee of the U.S. Consumer Product Safety Commission, a different kind of quiet settled over the walnut tables and brass microphones. On the witness table sat a dozen plastic jugs, blue, green, pink, 1-gallon containers, the kind you'd find on a garage shelf next to a rusty wrench and a half-empty can of motor oil. They looked harmless. They looked like ordinary commerce, and they were, each one of them, a product of compromise. The hearing had been called because something had not been done. For decades, since the first known cases of ethylene glycol poisonings in the 1920s, the same scenario had repeated itself. A child, a pet, an elderly parent, a confused adult, someone who tasted a sweet liquid from a familiar container and swallowed enough to begin the slow crystallization in the kidneys. The chemical industry knew the danger. The medical literature had documented it. The deaths were cataloged, filed, forgotten, then cataloged again. And still the jugs on the shelves remained sweet. The reason was not ignorance, it was preference. The bittering agent that would eventually be considered, denatonium benzoate, marketed as Bitrex, is a curious substance. It is the most bitter compound ever synthesized, detectable by the human tongue at concentrations as low as 10 parts per billion. A single drop diluted in a bathtub of water would still make the liquid unpalatable. Scientists had developed it to discourage accidental ingestion of household chemicals, particularly by children. It had no color, no smell, no function beyond rejection. It was, in effect, a gatekeeper made of pure sensation, and it worked. In countries where it had been added to antifreeze, accidental poisonings dropped by measurable margins. The data was clear. The solution was simple. But simplicity, in the world of industrial regulation, is rarely the winning argument. The industry representatives who sat across from the commission that winter did not argue that the poison was safe. They argued that bittering would hurt sales, not because consumers would stop buying antifreeze, but because they might stop buying it from brands that tasted unpleasant. There was a logic to the objection, and it was not entirely cynical. Antifreeze is a commodity. When the product is nearly identical across manufacturers, the taste becomes a differentiator. A bitter batch, even if harmless after a single sip, might be perceived as defective. Racing coolants, de-icing solutions, even certain industrial lubricants could not be bittered without altering their formula in ways that affected performance. The engineers who designed these fluids had optimized every property except one, the risk of death. And that, they argued, was not their problem. It was a labeling issue, a child-resistant cap issue, a parent's responsibility issue. The paradox, sitting there on the table in colored plastic, was that the sweet taste had been recognized as dangerous for over a century. Charles-Adolphe Wurtz had noted it in 1859 with a kind of innocent curiosity. He did not foresee the jugs, the hospitals, the funerals, but later generations did. They knew the sweetness was a trap. And when they finally decided to close the trap, they could not agree on the shape of the latch. The law that had been born from the elixir sulfanilamide disaster in 1937, the Food, Drug, and Cosmetic Act, had given the federal government authority over drugs, but it had not given it authority over antifreeze. Ethylene glycol was not a drug. It was a solvent, a coolant, a chemical tool. It lived in garages, not pharmacies, and so the teeth of the law did not reach it. For 60 years, it remained exactly as sweet as it had always been. The hearing room that day was not a turning point. It was a negotiation. The commission would eventually require child-resistant packaging for antifreeze in the 1990s, a measure that reduced but did not eliminate accidental poisonings. Bittering remained voluntary until individual states began passing their own laws in the early 2000s. Even then, the requirement applied only to automotive antifreeze sold at retail. Industrial formulations, racing coolants, de-icing fluids, these were exempt. The sweet taste continued to exist in places where the law decided it was acceptable, and in those places the poisonings continued. Consider the geometry of that decision, a legislative map of the United States, each state a different shade of safety. Some mandated bitterness, some did not. A driver could cross a state line and find the same product, in the same colored bottle, tasting different. The chemical had not changed. Only the permission had, and the deaths, those followed the line of least resistance, as they always do. A child in a state without mandatory bittering, a pet in a garage where the jug had been bought in a different county, a man who wanted to end his life and found a sweet liquid in a place where the law had not thought to add the bitter. The strange part was not that the industry fought the change. That was expected. The strange part was that the change, when it came, was not complete. The same chemical that had killed children in Nigeria that had filled emergency rooms with patients seeing snowflakes in their urine, that had been used in quiet domestic murders. That chemical was still allowed to be sweet in some containers, some contexts, some jurisdictions. The bitterest substance known to science had been added to a poison, but the law could not bring itself to make the addition universal. Safety had to taste acceptable to commerce, and commerce, in its own measured way, argued that the taste of safety was too unpleasant to sell. The bottle on the table in the hearing room, the pink one, with the label that said coolant in friendly white letters, what did it contain? It contained a molecule that had been known since 1859 to kill in doses of 100 milliliters. It contained a substance that, when metabolized, turned into razor blades of oxalic acid, crystals that would shred the delicate filtration units of the kidneys. It contained a history of accidents, miscalculations, and deliberate cruelty. And it tasted exactly like it had always tasted. Sweet. Because somewhere between the laboratory and the garage, society had decided that the risk was worth the price of a pleasant flavor. The hearing ended. The jugs were packed into cardboard boxes and carried out by staff members who did not look at them. The testimony was entered into the record. Bills were drafted, amended, watered down, passed. Some states added bitterness, others did not. The poison remained on shelves, in warehouses, in the back seats of cars. It remained in the places where people would find it, taste it, and not know what they had done until the crystals began to form. And the bitter aftertaste, the one that had been designed to save lives, remained optional. A product of compromise. A chemical treaty signed in the margins, leaving the sweet center untouched. The discovery of denatonium benzoate did not end the story. It made the story more complicated. It introduced a choice where none should have existed. And in that choice, the quiet archive of ethylene glycol gained another entry. A legislative hearing room. Government witness tables stacked with jugs of blue, green, and pink antifreeze. Each one a product of compromise. Some bitter, some sweet, all still legally sold. The bottle was small enough to disappear in a coat pocket, but large enough to shape a border. The border was not drawn on a map, it was drawn on a tongue, and on one side of that line, the sweetness remained. On the other side, the bitterness began. But the line itself was drawn by legislation, not by chemistry. And chemistry, as it always does, waited. The driveway is dark, but the puddle is not. It catches the street lamp's sodium glow and bends it into a color that belongs neither to water nor to ice, a blue-green that seems to hum with its own cold light. The dog collar lies a few inches away, leather stiffening in the January air, the brass tag still readable if you bend close. The name is worn smooth on one side, but the phone number remains. The puddle does not move. It will not freeze completely because its freezing point is lower than water's, a small chemical defiance that keeps it liquid long after the rest of the driveway has turned to black ice. And in that stillness, the substance begins its slow migration into the ground, molecule by molecule, carrying its sweetness into the dark soil. This is where the story goes quiet. Not because the poison loses its power. It does not degrade quickly. Spilled on asphalt or concrete, seeping through gravel into the earth, ethylene glycol remains stable for months. It does not evaporate into the air like a warning. It does not change color or smell. It simply waits, held in the pore spaces of the soil, slowly oxidizing into glycolic acid and then oxalic acid, the same transformation that happens inside a human liver. The ground becomes a slow chemistry set. Rain carries it deeper. Aquifers receive it without protest. Once it reaches groundwater, it can persist for seasons, the molecules moving at the pace of continental drift, their toxicity intact but invisible. The archive of a spill is written in soil layers, not in ledgers. 100 milliliters. That is the amount that will kill an adult human. About the volume of a small glass of wine or a child's sipper cup. For a cat, it is less than a teaspoon. The sweetness ensures that the dose is never measured with intention. It is lapped, sipped, swallowed before the tongue can register that something is wrong. Cats are particularly vulnerable because they groom their paws after walking through a puddle, ingesting a film of liquid that tastes like sugar water. A teaspoon is nothing to a person, but to a feline kidney, it is a lifetime of work compressed into 12 hours. The animal collapses, vomits, seems to recover, then seizes, then stops. The owner finds the collar in the puddle, but by then the poison has already completed its work. The body will show calcium oxalate crystals under the microscope, luminous, star-shaped, beautiful, in the way that destruction can be beautiful when you are not the one being destroyed. And here is the final irony, written into the chemistry itself. Those crystals, the ones that shred the kidney tubules, that lodge in the brain's capillaries, that turn urine into a slurry of microscopic razors, are chemically identical to the stones that form naturally in millions of human kidneys. Calcium oxalate monohydrate, the same mineral, the same crystal lattice, the same hardness. The only difference between a lethal dose and a routine biological inconvenience is the quantity and the rate. A kidney stone sits in the renal pelvis for years, sometimes painless, sometimes agonizing, but always contained. The crystals from ethylene glycol poisoning form everywhere at once, precipitation happening so fast that the body cannot isolate them. The mineral does not change its nature. The body changes its capacity to tolerate it. The poison and the pebble are the same thing, separated only by the patience of time. That patience is what makes the archive so difficult to read. Ethylene glycol does not announce itself in the environment the way that other industrial contaminants do. It has no distinctive odor, no vivid color in its pure form. The blue-green of antifreeze comes from added dyes, not from the molecule itself. Spilled on a garage floor, it evaporates slowly, leaving no residue that would catch a janitor's eye. In groundwater, it is tasteless at toxic concentrations because the sweetness is detectable only above a certain threshold, and dilution erases it. The monitoring wells come back clean, or they do not look at all, because the tests are expensive and the regulations are voluntary. The archive holds the poison in its pages, but the pages are underground, unread, waiting for a drought or a well pump or a child's mouth. The dog collar on the driveway is a kind of object lesson. It is the only visible evidence that something happened there. The puddle will be gone by morning, absorbed or evaporated, leaving only a faint stain on the concrete that could be oil, could be water, could be nothing. The ethylene glycol itself has migrated downward, into the frost line, into the water table, where it will travel at the speed of groundwater movement, a few meters a year, sometimes less. It might emerge in a neighbor's well 3 years from now. It might never emerge, diluted below detection, a trace that no regulator will ever call a violation. The archive does not forgive, but it does not speak unless you know how to listen. Its language is the language of soil chemistry, of calcium oxalate in urine sediment, of a brass tag with a worn-down name. We return then to the substance itself, colorless, sweet, and common in garages across every latitude. It has been used to murder spouses and to counterfeit medicine. It has been drunk by children who mistook it for juice, by animals who did not know any better, by men who thought they were buying cheap whiskey. It has killed in the time it takes for a liver to turn a sweet liquid into 1,000 microscopic knives. And yet, at the end of all these stories, the molecule remains unchanged. It does not learn. It does not regret. It does not even remember the bodies it has passed through, because memory is a property of biological tissue, not of industrial chemistry. The ethylene glycol that sat in a blue jug on a garage floor last winter is the same ethylene glycol that killed a cat in Ohio and a child in Nigeria and a man in a hospital bed who had been drinking from the wrong bottle. It is the same substance that the French chemist Charles-Adolphe first tasted in 1859, noting its pleasant sweetness with no apparent concern for what that sweetness would do. The quiet archive closes its door. The puddle freezes after all, because the temperature drops far enough to overcome the freezing point depression, and the blue-green light hardens into a thin lens of colored ice. The dog collar will be picked up in the morning by someone who does not know what happened, thrown into a trash can, forgotten. The earth beneath the driveway will continue its slow absorption. In a basement laboratory somewhere, a technician is running a gas chromatograph on a water sample that was pulled from a municipal well in a town that has seen a cluster of kidney failures. The chromatogram shows a peak at the retention time of ethylene glycol. The technician notes the result, files the report, moves on to the next sample. The archive does not need to be read to be complete. It only needs to exist. And the sweetness, even now, is still being tasted. The sweet molecule never needed intent to kill. It only needed a body that would try to digest it, a liver that would turn a pleasant taste into crystals, and a world that kept the bottles within reach. What the descent uncovered is that the sweetness itself was never the secret. The secret was the gap between first taste and final consequence, a gap measured in hours and in the slow patience of enzymes. The laboratory notebook from 1859 still holds the word remarkablement, remarkably sweet, and that note is now evidence of something its author never intended, a century of bodies that became archives of calcium oxalate, a dog collar on a frozen driveway, a child's crayon drawing on a blue plastic jug, snowflakes in urine that are not snow at all, but the signature of a poison that vanishes as it works. The broader truth is that usefulness and danger travel together, and institutions do not always catch the moment when one becomes the other. The chemical did not change. The law caught up only after the bodies were counted, and even then, the bitterness remained optional in some jurisdictions. The silence of the supply chain, the patience of groundwater, the ordinary shelf in an ordinary garage. These are the places where the archive is written, not in ink, but in crystal lattices and soil layers. Now the hatch opens. The pressure eases. The darkness thins, and the cold sea air is sharp and clean. Some substances carry their history best when they remain in the archive, not in the hand. If this kind of quiet descent into science and history is what you came for, you can subscribe to the Deep Archive. The sweetness is still there, but now you know what it leaves behind.